Yeah, so my name is Alice, aka Dr. Nicholl. I am a dentist. I've been qualified for almost 4 years now. So I graduated 2017. Um, I went straight into general practice. So I've just been working as a general NHS dentist since then. University wise, I applied for dentistry, got into dentistry kind of straight away. I went to the University of Newcastle. So yeah, I was there for 5 years, obviously doing dentistry, and then for my foundation year, I applied to Cornwall because I fancied a change of scenery. I was only meant to be in Cornwall for a year, but it's now been 4, and I haven't left. So I'm still here.
So I guess first question is like, why dentistry? There's a bunch of different healthcare professions you could go down for to. So
Yeah. So I think there's obviously a few different answers to that. There's kind of like the interview type of answer that you would give, and then like the realistic answer. So for me, I was always very good at school. Like was always a grade A student. So whenever it came to choosing university courses, for me it was always going to be between like veterinary medicine or dentistry. Um, the realistic reason why I went into dentistry, my dad was a dentist. He owned a dental practice, so I grew up with dentistry. Kind of knew the lifestyle a bit. As well, whenever I was weighing up kind of the dentistry medicine sort of things, I was looking at things like working hours. So obviously dentistry, big difference from medicine. 9 to 5 usually, weekends off. You're never really on call, anything like that. Um, Most dentists in the UK are self-employed, so you've got a lot of control over your working hours, where you work, how much holiday you want to take, things like that. And then obviously pay is one as well. Where dentistry is kind of one of those jobs where for working a 9 to 5, it's probably up there as good as you can get
very
paid.
much so. Yeah.
The more kind of like university interview appropriate answer would be things like, again, was always into science and was always interested in healthcare anyway. With dentistry, I guess you could argue there's a bit more of an artistic aspect to it. So, doing fillings, dentures, veneers, all that sort of thing. If you are a bit more artistically inclined, potentially dentistry would be an option. And then there's things, where you've got people coming in every day who have either, neglected their teeth for years and they want to turn things around, or people who, have really bad toothache, and people often say toothache is one of the worst pains you can ever have. So you're seeing people like that every day, and fairly quickly you can come up with a solution to get them out of pain, or get them some teeth back and things like that. So similar to medicine, you can make a big difference to people's lives over a few short appointments.
Yeah, for sure. And I guess medicine and dentistry are very similar in that aspect, in that it's very healthcare centric, yet
Yeah.
again, it's almost an art in that you're trying to improve somebody's life, if that
Yeah.
by like cosmetics or just by general healthcare and
Yeah.
hygiene, etc. So I totally agree with that.
Yeah.
So with your application, then did you have to set any admissions exams? Well,
So yeah, the UK CAT exam. As far as I'm aware, there's a few different ones that you can sit depending on what university you're applying to. So some take the BMAT, most of them are the UK CAT or the UCAT, whatever you want to call it. So I sat the UK CAT just because all the universities I was applying to wanted that anyway. Um, so yeah, and luckily I did pretty well in that. So whenever I was choosing universities to apply to, I went for ones that lent more heavily on the UK CAT results compared to the others, because I was up among the top of kind of the results for it. So I chose wisely and kind of used that to my advantage.
for sure, and especially with the competitiveness of dentistry,
Yeah.
I guess it is very much changed now. It's probably got even more competitive with the applicants, but again, it's a very similar subject to medicine in that the admissions test and the interview stage are both extremely competitive. You've got to
Yeah.
almost score above everybody else to even get that chance at interview.
Well, that's the thing. It seems to be getting, yeah, as you said, more and more competitive. Because I'm in a few like dental forums on Facebook, and there's a few older dentists whose children want to go into dentistry, and they've been asking about this sort of thing. And it used to be just exam results and maybe Duke of Ed was enough. And then
Yeah.
now you have this work experience and that work experience and projects on the side. And I've done this and I went out of my way to do this project and research this on my own and entrance exams. And yeah, I just feel like now it's like more and more and more. And like even the grade boundaries now are creeping up. So whenever I applied, everywhere I was looking for just kind of 3 A's at A level. Now there's quite a lot of universities. The minimum is like 1 A star, 2 A's, or 2 A stars and an A for dentistry. So it's reaching a point where unless you're getting kind of maximum grades and everything,
Yeah.
off.
Yeah, and that's a big issue. Like having a family member that's coming towards retirement who's a GP all his life. He's
Yeah.
even he was shocked to say, yeah, when he applied, he just needed to get okay grades. Yes,
Yeah.
maybe do an interview, and then he'd get in, no problem. Like there
Yeah.
was no competition there, and I don't know if it's become like an elitist degree, if you want to call it that, or if it's just generation on generation of building up the stigma of doctors are, a highly paid job, or doctors are, well looked after in the NHS, or
Yeah.
I guess it's a combination of a little bit of everything, but you can clearly see the trend of it becoming more and more competitive to get in. You kind of want to know, well, where's it going to go in the future then? They've got the
Yeah.
admissions exams. Like graduate entry medicine, I think it's something like 30-1
Yeah.
applicants to get in. It's like how much more competitive do you want it to get?
Yeah.
Like, and I think that's the big issue at the moment.
Dentistry is the same, where there's a lot less dental schools or universities offering dentistry compared to medicine, and even within universities that do offer both, generally the dental year group is like half or a third of the size of the medical group.
Yeah.
So one thing to be aware of is that if you're thinking, I'd quite like to do medicine, but I don't know if I'll get in, I'll apply to dentistry because it might be easier. That is not the attitude to have at all. Do not do that. Please do not go down that route. Because I think you'll very quickly find it's equally competitive. So the whole thing people joke about, not so much anymore, but they used to joke, oh, are you a dentist because you didn't get into medicine, and is that why you did dentistry? But both as competitive. You need the same grades. Arguably, dentistry in some places is more competitive due to the lack of universities, places. So yeah, if you're thinking of applying to dentistry rather than
Yeah.
medicine, yeah, not the way to go.
No, and I can really relate in that you get it in biomedical science all the time. Did you apply for biomed because you didn't get into medicine? It's like, well, no, it's just like I didn't really think of it at the time, like something I wanted to do. So it's very much, I think medicine is looked upon as, this gold standard, and
Yeah,
nothing can be it. But when you actually look at it, you're like, well, you're learning the same stuff in biomed
yeah,
and dentistry. You just don't have your clinical years on top. So you're technically
yeah,
learning the same stuff, just without the clinical years. But
yeah,
I totally agree with, I guess, that stigma that's portrayed. So for sure.
yeah. I know Newcastle. Obviously every university is slightly different, but in Newcastle, kind of first, second, and half a third year, your curriculum is pretty much the same as medicine. We would do the same. We have to learn about the whole body, even though we then focus on this part. And same with like anatomy and cadavers and things like that. We'd be looking at all the different body parts as well. So yeah, first, second, and half a third year, pretty much the same as medicine anyway. It's just then halfway through third year, we go on to treating our own dental patients, and then obviously focusing more on actual dentistry and oral surgery and maxillofacial. So yeah, quite a lot of the curriculum is very similar until towards the end, and then you do branch off a little bit.
For sure. And I guess going back to your interview stage, so with your interviews, presumably they would be panel at that time, if I'm right.
So I had applied to King's,
Okay.
Field, Cardiff, and Newcastle a while ago now. Newcastle. So I had my interviews for Kings and Newcastle within a week of each other, I think, quite early on. Because I think they had looked at it in terms of UK CAT, so the higher scoring applicants were seen first. So I had my interview at Kings. It was like one of those multiple mini interview
Okay.
things. And then Newcastle was just two of the head people at the dental school interviewing. Newcastle had then got in touch. It was the next morning, actually. It was very quick to offer me a place. And I really, really liked Newcastle, knew that I loved it. I knew that if I did get any other offers from other universities, it would be for the same grades anyway. So I actually then declined the others and didn't sit interviews. Obviously, I was quite lucky that, I went to university, really liked it, and then literally the very next day I had an offer. So there's kind of no point stressing myself out with other places and things if I didn't need to.
Yeah, I wish universities were like that now, to be
Yeah.
frank. And I know some students that, especially like the graduate entry side, have had to wait, God, like 3-4 months. They had their interviews in December. They're not getting back to like April. And you're like, what? You're going to finish your degree.
My Newcastle interview had been end of October, start of November, I think. And yeah, so I had my offer. And then, although I'd had the interview at King's the week before that, hadn't heard anything yet. So I was like, Newcastle it is. I'm going to just take it and, yeah, run with it, really.
For sure. And yeah, I guess it's quite a long while back, but looking back at your interview stage, is there anything you thought you specifically did well, or anything you specifically thought like you could improve on?
I feel with any interview, like I came out of both of them thinking, oh my God, I've done horrendous. And I remember coming up with the Newcastle one especially, and my mum being like, so how did it go? And I was just like, I think I cried actually. And then obviously the next day they offered me a place. So sometimes it can be obviously a bit difficult to tell how you're doing. For me, I really didn't like the multiple mini interview at King's. Like some of the stations, there was one, they showed me like this medieval painting of like these two like medieval men with like a lute and everything. And they asked me to describe what was in the painting as if I was talking to a blind person. And it was like, you have like 5 minutes looking at this really detailed painting. Like, where do I begin? If I say there's a man holding a lute, does the blind person know what a lute looks like? Or descriptive? And they were a bit more intense with the questioning about things. So obviously each station, I think there's that one describing the painting. Then there was one about my personal statement, things I'd written there, and then a few other ones about dentistry, and then one about what I knew about Kings and London and things like that. So that one I think was tough because you're like racing against the clock, and then you're kind of panicking about the last station, then you're straight into your next one, and a bit all over the place. So for me personally, I didn't like that style. The Newcastle one, at the time I thought it went terribly, but it was all right. So it was just like two people, just you two, them in a room. It was a bit more of like a laid back chat about things, which I think suits me and my personality a lot more than like, I know the King's one was almost like an exam I was sitting. But Newcastle was like a bit more of a chat. They asked me about my personal statement, different hobbies and things that I had on that. I don't think they really questioned me much about dentistry at all. I feel like in Newcastle, they were a bit more interested in you as a person and kind of judge you what you would be like as a dentist with patients, as opposed to ticking off a checklist like, yes, you're academic, yes, you do this and that. So yeah, Newcastle was a bit more of a chat about personal statements and things. And then like what I knew about Newcastle in general and the northeast of England, and was there anything up in the northeast that I was looking forward to seeing and things like that. So yeah, it clearly went okay because I just kind of chatted 20 minutes, and I felt like it was a lot more relaxed. You go in, your heart's like this, but then after a little while, you kind of talking about yourself a bit more. It is a bit easier. But yeah, with the Newcastle one, I had written on my personal statement that I was in critical thinking society at school, which I was. It was like, we did debates and things like that. And the interviewers were kind of like good cop, bad cop. So one asked me the nice, easy questions about myself and my hobbies. And then this other guy was like, so I see you're in critical thinking society. How do you know that you can trust the media? And I was like, So I was like, well, you can't really, just kind of have to take it on face value, or do your own research, yada, yada. And then he was asking, how can you trust like medical journals? When you're looking at the British Dental Journal, how do you know the stuff in that is real? So at that point, I was just honest and I said, I don't know at this point. I don't know. I'm not a dentist yet. You know, if I'm reading a journal like that, I have to take it on face value that they're telling the truth, because I haven't done the dental degree yet, because I haven't got into dentistry to really talk about it. So that's why I thought I had done so terrible at Newcastle, because for a lot of the interview I was just like, I don't know. I don't know. I can't say at this point. I don't know. I don't know the answer to that question. I think that probably worked in my advantage, maybe, that I didn't try and bullshit my way through an answer. So in short, I think if you're in interviews, if you don't know something, say you don't know it. You know, try and relate things back to yourself and what you do know, and don't try and just talk shit, bullshit things, because these people are very experienced and they will know when you're talking rubbish and when you're making.
Yeah. I think it's two big differences with having the MMIs. You're trying to score these points. You got 5 minutes to score. If we say you want it out of 10, you want to score as many points out of 10 as possible.
Yeah.
With a long style like panel interview, it's very much more fluid. You can gain marks and lose marks, and overall you're going to come out at an overall score at the end of the day. But it's more down to their discretion. Again, with the MMIs, it's most of the times, like, say you're doing a role play, it's going to be somebody like freelance, an actor who's just reciprocating the conversation. So you're getting marked on how you respond to that actor, not how well you are going to be as a doctor, how good your CV is, how good your personal statement is, like any extracurriculars. It's how you, in that moment, respond. Say Breaking Bad News, for example, how you respond to that patient is Breaking Bad News, and you're being marked on something so obscure, yet you might have the best personal statement in the room. And I guess that's one thing to think about in how you approach the different styles of interviews like that.
Yeah.
So I guess to move on to the nitty-gritty side of dentistry and the academic side of it. So I guess looking back now, is there anything you wish, I guess, you would have known before you began your degree at dentistry, or I guess before you began dentistry in general?
I don't know. I feel like something that probably wasn't emphasized enough or people know enough about is probably the kind of the stress of it. I think a lot of people do think that dentistry, you're just kind of sat in your ass and do the teeth problem. But, you know, dentistry alongside veterinary medicine and lawyers, we have some of the highest suicide rates in professions as well. Dentistry has a real problem with claim culture, which is a really big problem at the minute. There's a lot of no win, no fee lawyers that a patient can say, right, basically, I'm not happy with my dentist. They'll request your notes and they will go through every note that you've ever written on anything, pick out, you know, the one time you've forgotten to write this, and then they will piggyback onto that. Even if that's not the original problem that the patient was complaining about, they'll go after you. And nowadays it's a lot easier to pay patients off than it is to go through the whole court system. That's a bit of a problem as well. And then also just basically about the GDC, so the General Dental Council, it's our regulator. We don't have the best reputation amongst dentists. In the past, you know, our registration fees are far higher than medicine, even though, you know, medics are doing open heart surgery and things. Up until recently, they were nearly £1,000 a year. They're now being reduced to £100 a year. But a while ago, the GDC were in trouble for taking out full-page newspaper adverts, basically saying, "Are you unhappy with your dentist? You know, let us know. Basically, we'll get them in trouble." As well, they've been caught out recently paying undercover actors to purposefully go in to try and get dentists into trouble, which is illegal. So yeah, there's a few bits and pieces like that which you don't really know about before dentistry. They don't really talk about it while you're at university. It's only once you're in practice you're a bit like, oh god. You kind of find those things out as you go.
That sounds like it's more about the culture of dentistry rather than the academic side. Again, I think that happens in most jobs. Obviously, you got the GMC, which is obviously had its own issues, but I'm very surprised that happens. I guess the legal side of that happens in the UK.
Yeah. Yeah.
Wow.
Behavior by them. But yeah, academically, surprise-wise, dentistry, I don't think there was anything that really took me by surprise. Like, I knew it was going to be a pretty hardcore degree. It's obviously 5 years. You know that any degree that's 5 years is going to be,
Yeah.
especially when you make it to third year and your friends who aren't doing dentistry all graduate and leave, and then you're still
Very
going.
true. Very true.
Yeah, like academically, I wouldn't say there was anything that took me by surprise. I kind of knew it was tough. I knew there'd be a lot of essays and like research that you'd have to do on top of clinics and lectures. So I think that aspect, I kind of knew going into dentistry what I was signing up for.
And I guess what's your opinion on, obviously you've got graduate entry dentistry now. I think offered only a few
Yeah,
universities. I guess what's your opinion on that, because it's very controversial within the space of like medicine and
yeah,
probably dentistry as well, and having having a set course that you need, all these set modules that you need to know, and then almost condensing them and only, I don't want to say studying the minimum, because you're having to condense a year, 2 years into one, but it's having to almost miss out some bits of information at that point to, I guess, condense the course.
yeah. I mean, I've got no real problem with it. Because at the end of the day, you still have to pass finals, and then to actually do the next part of your dental career, we have a foundation year the same way that doctors do. So it's done through national recruitment, and there's more applicants every year than there is for actual training places.
Oh,
So inevitably, every year there's a few hundred people who have graduated dentistry but who can't work as a dentist yet because they didn't score high enough to make it. So if someone, goes to graduate entry and they do well enough to then be picked up and get a job and be able to do the next part, then clearly, they have enough knowledge. And to be honest, like first year of dentistry, I'm sure it's the same for medicine. A lot of it's like microbiology and all of these learning the names of all these random bacteria that live in different parts of the body and like stuff that you're never going to need again. They say that you should retain the knowledge, but you're never going to need it again. Could not name you, half of the stuff that I had to learn in first year. Have I needed to know it since then? Absolutely not. Up in everyday work. So I think, realistically, yes, it's good to have that foundation knowledge from first year going forward. But is it essential to being a dentist? No. So if they're kind of cutting like that sort of thing,
yeah.
I don't. Fair play to them. Lucky them.
Wow, and that really surprised me in that, obviously with when you apply for your GMC, you get your qualification to be a doctor, and you go into your foundation years.
Yeah.
Usually, once you graduate and once you become a doctor, you pass your finals, you can almost find a placement in the UK. So
Yeah.
you want to rank highly in your cohort so you can get the highest score to, say, if you want to go to London or
Yeah.
Cambridge or Oxford, the high tier placements for your foundation year. But not many people are picking up places like in the middle of nowhere, Scotland, for
Yeah.
example. So I'm guessing, is that a common occurrence of people missing out on their placements each year?
Yeah, so there are people every year that it'll happen to. So I don't know what it's like now, whether it's changed a bit, but my year, I think there were like 1,000-ish dental students who went through the national recruitment sitting those exams that you do after university. And then I think there were only maybe like 850, 900 places. So
Wow.
yeah, there were like maybe 70, 100 people that wouldn't have got a place. So you've got an option then of seeing if somewhere will take you on privately to work as a dentist that works slightly differently. Or the other option is obviously having a gap year and then trying again the next year. So yeah, that's a bit stressful as well. I guess the academic side of things is you think you've passed your dental degree and if
Yeah.
one more jump through. But it works the same way where you're ranked 1 out of 1,000 or whatever. You applied wherever you want to go to, and then depending how highly you rank, you're more likely to get your first choice.
Yeah, for sure. And I guess to move on, one thing that I guess people don't really focus on within dentistry is the diversification that you can have within the
Yeah,
career. And the medicine's renowned for your GP, and then you've got your surgeon. they're totally different
Yeah.
specialties. Yet everybody knows a GP, everybody knows the surgeon role. So I
Yeah.
guess can you just touch on like I guess the diversity of dentistry? Obviously, everybody knows their dentist that they go to for regular checkups, but then you've also got orthodontist, etc. You just
So yeah, with dentistry, you've got a lot of different options. So there's obviously kind of once you graduate, you've got the option of doing the standard foundation training, which you then become a general dental practitioner, so our version of a GP. So within that, obviously, you have the skills to do a little bit of everything anyway, but you're not a specialist. The other option that you can go down is something called DCT, which is dental core training. That's like hospital dentistry. So with that, you work within the hospital. That's a lot more kind of, sedation, maxillofacial, oral surgery, that sort of thing. Quite often you'll be working on A&E alongside the doctors. So if anybody comes in with facial injuries, it's technically a dentist some of the time that's kind of looking at them. Then you've got options, like research and things like that, if you wanted to stay to the more academic side. Then kind of moving up through the ranks, if you've been a dental core trainee or you've been a general dentist, you can then do further qualifications to specialise. So as you said, things like orthodontist, there's endodontists who specialise in root canals, things like that. There's obviously oral surgeons, there's the big boy maxillofacial as well, if that's something you're interested in. And then, there's other things like prosthodontists that specialise in dentures. Some of them would also do like obturators for people who've had cancer and had to have, half the face taken out. So they would do all that work. And then there's also kind of the private dentistry, cosmetic side of things that you can go into. So purely aesthetics, so like whitening, crowns, veneers, that sort of thing. Also within that, there's little side careers you can do. So for me personally, after I did dentistry, I was like, right, that's enough dentistry for now. So the next little bit of training I did was facial aesthetics. So, Botox, fillers, chemical peels, that sort of thing, which actually ties itself in quite nicely with dentistry, because if you're doing cosmetic stuff anyway, it means you can go from here kind of to the rest of the face. So, yeah, if you were interested in dentistry, it's important to know that you're not just going to be stuck in general practice if that's something you're not interested in. There are a whole host of careers. And obviously, you can choose to go on to be dual qualified, so you can go on to do medicine after dentistry, or the other way around if you do want to go into maxillofacial or something like that.
yeah, for sure. And I guess I'd also love to touch on the public and private aspect of it as well, because I think it's more pronounced within dentistry than it is in medicine. Everybody knows the NHS is for medicine
Yeah.
primarily. Not many people know there's a private side to medicine, but with dentistry, I think it's much more pronounced. So I guess if you could touch on that.
Yeah, so basically, as we know, there is NHS dentistry. Unless you're, under the age of 18 or in full-time education or receiving some sort of benefits, they get it for free. Everybody else, you do have to pay a small amount. It is heavily subsidised, so people often complain about how expensive private dentistry is, when really that's the true cost of dentistry. It's just on the NHS, it's subsidised to a small amount. There's always been a small private sector with dentistry, mostly because people like a bit more freedom with their careers and being able to offer kind of fancier options, taking more time with things, doing things like implants, fancier surgery, things like that, which you don't have the time or the funding to do in the NHS. About 10 years ago, the government then had decided to change the way that dentists were paid on the NHS in England and Wales, which didn't go down well. So a lot of dentists then decided that they had had enough working for the NHS, and they decided to go either half private or fully private. So that's why nowadays there's a lot more divides and there is a bigger private sector. So within the NHS, it is focused mostly on health. So all of your cosmetic stuff like whitening and white fillings and that sort of thing aren't covered. It's for, blood pain and restoring function. So whether that's by doing fillings or making dentures, it's just about getting people kind of nice and healthy again. Privately, as I said, you've got a lot more options of different treatments you can do, and more modern kind of fancy stuff like implants as well for teeth. So yeah, and like the NHS, the way the payment works there, everything's split into 3 bands. So you've got band 1, which is about £22. It covers your checkup, x-rays and a scale if you need it. Then we've got band 2, which is about £65 now. That covers all of the previous banding, plus if you need any fillings, root canals or extractions. And then we've got band 3, which is about £280, which again covers the previous 2 bands, plus if you need kind of crowns, dentures or bridges. And that goes for like no matter how many of something that you need. So if you need 1 filling, you'll pay £65. If you come in and you need like 20 root canals and 20 fillings, you still pay £62. Which is why a lot of dentists left the NHS, because there'll be some days where you get people in who need a lot of work doing, and by the time you go home after a full day of work, you'll have earned far less than minimum wage by the time you divide out what you've been paid by the amount of hours that you put in.
Yeah, and I feel with that, have you found almost a divide in the public dentists just wanting to do, like, is it almost they want to get the quick bands, you know, the £22 here, because say you're doing a checkup, it takes minutes. When you're doing extensive surgery, you know, or extensive fillings, that can take you hours at that point, can't it? So it's almost, do you feel like they're trying to subsidise the NHS funding with, you know, getting more patients in and outflow?
Yeah, so the reason that it was changed in the first place is because, I mean, Northern Ireland and Scotland is still like this. They're paid fee per item. So if you need 10 fillings, the patient will pay for 10 fillings. If you need 1 filling, pay for 1. The government in Wales had originally stopped that because they said that, you know, there were cases of people having work done that they didn't need because the dentist could claim for it. So they thought that the banding system would cure that, because then dentists don't want to do 20 fillings if they don't have to. But I do feel like it's not, can push some people the other way, where you think, right, so, you know, and it's important to remember as well, although the patient pays £65, the dentist will only get about £30 out of that. So we don't get that full amount, which obviously makes it even worse then. So
Yes.
yeah, so it means that if someone is coming in who needs a lot of work doing, you know, some dentists won't sit down and do it all in one go. They'll maybe do a little bit and then get them back in another few months so they can claim another band 2 and do another little bit and then put the other bit off until they can kind of claim it over time. So it is a bit of a difficult one. We try to counteract that by having our diary set up in a way where you have a certain number of checkups a day, a certain amount of time for treatment time, and then a certain amount of time for complex treatment time, so that you're not spending some days doing really complex treatment all day and not getting paid for it, because you don't get paid until the treatment is completed as a whole. So if someone's coming in for a lot of appointments, you don't get paid till the very last appointment. So I mean, we set up our diaries in a certain way to try and counteract that. So we are doing a little bit of everything every day, so that you do have kind of a constant income coming in, instead of these big blocks of people who need a lot of work, and then maybe some days where it's just the quicker checkups. But yeah, at the end of the day, if people need work doing, they need work doing. So you can't really.
Yeah.
So yeah, we just try to organise things in a way that makes it a bit easier to do.
Yeah, for sure. So I guess to move on, is there, I guess we've kind of touched on it slightly, but are there any particular myths or misconceptions, I think, that you felt were stigmatized throughout dentistry?
Well, there's a few of them. So as I've already mentioned, there's the whole, you know, did you become a dentist because you couldn't get into medicine thing. There's a thing where a lot of patients seem to think that we all have holiday homes and Ferraris and all of this stuff, which, you know, I'm sure there are maybe some private dentists out there who own their own practices that may have, you know, a Ferrari. But for the most part, especially on the NHS, like, not at all. So I think there is still that misconception that we're all secret millionaires, and because of that, some patients can be a bit funny about the fact that they have to pay for treatments. You know, they'll make comments about, "Oh, is this paying for your next holiday home?" No, it is paying for the filling that you need to have done. Things like that, where, you know, you sometimes do get a bit of backlash from patients about the fact that they have to pay and they think it's funding your lavish lifestyle. Obviously then as well, patients thinking that all of the money that they pay goes to us when we only get a fraction of it. And yeah, especially with COVID, I still read it online now, people saying how dentists are sat at home and we've not been in work all year and we've had a paid holiday for I'm self-employed, like if I'm not working, I'm not getting paid. But yeah, I've seen them say the same thing about GPs as well, how we're all hiding together in our bunkers and having a nice time. So yeah, just things like that. And then there's also, the reputation of dentists being butchers and how we cause pain and how we're all horrible, horrible people, which, on the one hand, it's quite funny, but the other hand, some days you spend a day and every single person who comes in is terrified to see you, and they make a comment about how much they hate coming to see you, and it's like, oh.
Yeah, it's very, it is very much a stigma. I guess it's everybody's personal experience with the dentist, and
Yeah.
so if you have a bad experience one time, it's the same as people who have a bad experience when they're a child. They don't like going to the dentist, or they don't like going to see doctors, etc. And it is a really serious issue that's obviously detrimental to their health at the end of the day. Going for, especially with dentistry and dentists, because it's not like medicine in that you have something wrong with you, you go get it checked up. With going to the dentist, it should be a regular appointment that you go for to have checks. Yeah.
Yeah, and all really is one bad experience as a child or one bad experience with a particularly bad dentist in the past, and then that's them set up for life being terrified. And then they cancel appointments all the time, and even when they do come in, they'll barely sit in the chair. You can barely look at anything. If they need treatment, they'll agree to get booked in for the treatment, and they'll just never show up. They won't come into those appointments. So yeah, it is a bit of a problem. Phobia of the dentist.
Yeah, for sure. So, I guess what keeps you motivated within such an intense course like dentistry, and I guess being a dentist in general?
Yeah, well, dentistry itself, while I was at university, the motivation was the fact that I had got into the course, and that's the tough part, really getting in. So I think around third year, everybody had a bit of a wobble. As I said, if you see other friends graduating and you're only halfway through, a few people were a bit like, I don't know if I can do this anymore, but you're already halfway. You've made it this far, you can do it. And then with the job at the minute, I do genuinely enjoy work. I like my patients for the most part. A lot of them are good crack. We have a nice time together. I enjoy the work that I do. I don't mind actual dentistry. I've never had a day where I've dreaded going into work. I like dentistry. I like doing fillings. I like making dentures, that sort of thing. And yeah, I like the people that I work with and everything. So I think obviously it's a lot easier to stay motivated if you actually enjoy the job that you do. And I think kind of with dentistry, the same as medicine, if you've made it that far where you're working and you're not enjoying it, it's worth considering that there are plenty of other options. Maybe the NHS isn't for you and you would prefer the kind of slower pace of private work where you can spend more time with patients and do more stuff. Or maybe you've decided that clinical dentistry isn't for you, so you want to go into research. Or, you've decided that you don't like most of dentistry, but you do really like making dentures, and that's the path that you want to go down. So I think with anything, if you've made it as far as studying medicine or you've graduated in medicine and you're not really enjoying it, rather than giving up completely and just losing all motivation, maybe look and see what other options there are out there and other paths that you can go down. You're on mute.
Sorry, I was on mute. That was a good catch. Yeah, sorry. That was a good answer. And I guess on the flip side to that, what what do you do for self rest, and how do you take care outside of dentistry? Again, obviously due to the fact of it.
Yeah, so I think for me, I've always been very good at the fact that I leave work at work. Like once I finish work for the day, I'm not going home and worrying about this or that or the other. It can wait until tomorrow. It can wait until Monday. So that's just me personally. I've never been a particularly stressy person, so I don't take work home with me. As well, I think it's a lot easier to kind of switch off with dentistry because it is only a 9 to 5. So once you're done at 5 o'clock, you're out the door. It's not like you then have weekend shifts and night shifts and things like that where you have to rest and recuperate, because it is just 9 to 5. You still have your weekends and your evenings spare. But yeah, my free time, I try not to do anything dentistry related. I would occasionally do the odd webinar here and there if it's something interesting, but I don't come home and read about dentistry and do more dental stuff. I come home, I watch Netflix, I go surfing, I go to the beach, I go dancing, dance class, things like that, the gym. So things like that, I just very much leave work at the door, don't worry about it, and then just get on with my hobbies.
Sure.
Yeah.
Sure, and I guess that goes true to, I guess, any job, not just like the healthcare professional side.
Yeah.
It's very much to have that split, and especially with, I always say, with such intense courses like dentistry, medicine, you need to not let medicine become your life. You need to, I guess, run your life around medicine, in that it's just a course at the end of the day. Your life isn't medicine. You are you, and that's part of you, yes, but you don't want your life to be just become medicine. It's very easy for it to, I guess, engulf all of your time, and you
Yeah.
can go as deep as you want. I guess
Yeah.
same with dentistry. You can study as much as you want, and it's almost a never-ending hole at that point.
Yeah, and I think there are people out there who do let kind of dentistry and medicine become their lives, but it works for them where, they aim to be at the top of their field and, big on social media and things like that. So I think some people, yes, can be set up for it to become their life, and fair play to them. But yeah, at the end of the day, you need to remember as well, the reason you probably got into medicine or dentistry is because you had other things that you did, and you had other hobbies and musical instruments that you played, and there was all that other stuff that you would have had in your personal statement, which is part of, and your personality, which is one of the reasons why they let you in the first place. So it'd be a real shame to kind of show yourself as a person and all these hobbies and fun things that you do, and then as soon as you get into medicine or dentistry, you just sack them all off and just let studying and everything take over your life. I think it's very important to have that work-life balance, because in the long run, I think you do a lot better anyway if you allow yourself to have breaks rather than just hardcore studying all the time. Some people, again, work well doing the hardcore studying thing. It works okay for them. I didn't at all. I was never a fan of the library. I used to, for like summer exams when it was nice weather, I used to blow up an air mattress and put it in the back garden and get a few like Coronas and limes and music, and I would just sit and like do my studying then. So I think as well, yeah, it's just knowing your own personal studying style. Just because everybody else is in the library, 5 days a week, it doesn't mean that you have to too, and it doesn't necessarily mean you're going to do badly if that's not your style.
Yeah, and again, it goes back to the competitive nature of, I guess, dentistry and medicine, in that once you've made it to dentistry and medicine, then yes, you're still competing with your classmates, but you're there. You just need
Yeah.
to pass and get, yes, average grades, but I guess there's that misconception, especially from a graduate entry point of view, in that, for example, my degree at the moment, you're having to hit those 70s and above all the time just to be within a chance of getting that interview. And you've got no security there. When you've made it, that security's there. You can not take your foot off the pedal. You can always relax a bit and reflect. Yes, I'm here now.
Yeah.
The only way I'm getting kicked out is by failing. So
If you've got into medicine or dentistry, it's a given that you're, at least somewhat academic anyway. You can't get into medicine or dentistry if you've always had D's and E's and things like that. So just by the fact you've made it into the course means that you are probably good at exams, you are good at revising, you're good at making notes, you're good at things like that. So yeah, maybe not take your foot off the pedal completely, but as long as you're passing the exams, you don't need to get 100% in the exams, you just need to pass them. So as long as you're passing, give yourself some free time, and especially university, like part of that is the whole party culture thing. I think even if you are doing medicine or dentistry, you still have time to have a good. I know Newcastle, we had a pub in the basement of the dental hospital called the Crown and Bridge. So every Friday it would be Dent Sock after uni, and you got free pints in the pub. We had a great past. We became dentists. So yeah, allow yourself some.
university and free alcohol do not go together. That's all I'm gonna say on that subject. So I guess for future, medical students and dental students watching this video, are there any golden piece of advice you give somebody going through their application process?
So do your research, obviously, before applying to universities. So some will look quite heavily at GCSEs, some will focus on A levels, some will focus on the entrance exams. So do a whole ton of research into that first, and then apply accordingly. Do good research into the universities, not just the dental side of things, but the extracurricular and the area as well. Because a lot of the interviews will ask you, so, why this university? And they don't mean just why the dental side of things, they mean about all the other stuff the university offers and about the city that it's in. So make sure you do research into all the other aspects, because as I said, they're interested in you as a person, not just the little, medicine dental robot. So make sure that you do research into the whole area. As I said before, kind of be yourself in the interview. Do not try and give rehearsed answers that you think that they want to hear, because one, they'll either tell that you're talking rubbish, or two, they'll have heard the same kind of rehearsed answers of everybody, and they're not going to be able to kind of separate you from everybody else. So don't worry about being yourself, showing a bit of your personality, that sort of thing. Because at the end of the day, what makes a good dentist or a doctor is quite often the personality side of things and the bedside manner, as opposed to just the academics. So those would probably be the three main things. And I guess the fourth one is both medicine and dentistry. They're big, hefty courses. They're very serious careers. So make sure you're applying and you're going into it for the right reasons, not just because you think, it's like a superiority thing, or for the status that you kind of want to be able to say you're a doctor, that sort of thing. Make sure that you've actually sat down and weighed up the pros and cons of everything, and whether you can realistically see yourself doing it for the rest of your life, and that it's right for you, and that you're doing it for the right reasons.
Yeah, and I guess the last point you made is one of the most important. That it's not like a normal degree where you can go study. I'm not going to name a degree because I'll offend somebody, but it's not like a normal. I'm going to say bachelor's degree where you can study it 3 years and then you can hop into a totally different field. With medicine or dentistry, it's a career for life, as you said, and you can bounce around that specific career, but you're almost solidified within those boundaries. And yes, you need to be serious that you actually want to go into it.
Yeah, and even with like medicine and dentistry, well, you could argue that you get a lot of transferable skills. If you do want to hop to a completely different career, unfortunately, a lot of people will look at your CV and think that you're overqualified, or you're not suitable for the role. So, in a way, even though people see it as top tier degree, unless you want to do something healthcare related, you can kind of cut yourself off from doing some other jobs, unless you either want to go back to university or kind of downplay the fact that you've done medicine in your CV, because it will raise a few questions. People are like, well, if you're qualified as a doctor, why are you applying for this job? Because I've got a friend who did fine arts, and then from fine arts she went into car sales, and now she works for like an alcohol company selling like whiskies and stuff to various bars and promotions around London. So there's degrees like that where you can hop around. But medicine or dentistry, if you're going through the stress of application process and then the 5 years of the degree plus your foundation years, you need to be sure that you definitely want to do it.
And I guess that was the example I was looking for with our I think that's an important point. In obviously it is a degree for life at the end of the day, and I think most people, again, hence why promoting the graduate entry scheme and having more availability is so important, because you only have one shot when you're 16 to decide what you want to do for the rest of your life. Some people are ready. I can tell you for a matter of fact, I was immature when I was 16. I did not know what I wanted to do. So why you have to decide the rest of your life on that 1 year is bizarre to me. But having said that, the graduate entry schemes that are now popping up is, I guess, vital to the system in having these people coming from, like you said, there's people from fine art to people with PhDs that I've spoken to who come into medicine. So they're very much a requirement and a vital part of the NHS going forward.
Yeah. And I think that's another important point, really, that just because you don't do medicine or dentistry as your first career, or if you do something different and you do think, actually, I want to be a doctor or a dentist, never too late. There's a guy in the year below me at university that had been a pilot for like 10, 15 years, and then he decided, you know what, I have always wanted to be a dentist. So he went and did, the few extra exams and A levels that he needed. He got some work experience, and then obviously applied and got in. So, if you are watching one of these videos and say you're doing something completely different for a while, and you think, no, you know what, my true calling is dentistry or medicine, it's never too late. It can change your mind. Yes, it may mean that you have to sit a few A levels and do entrance exams and things like that. But the NHS will always need doctors, so. Yeah,
That's it. That's the end of it. Yeah. So I guess finally, for somebody starting out their first day at, I guess, either dental school or med school, what would be your take-home tips for that student?
so kind of when you're starting off, I would say probably socializing is an important one. You want to get to know people that you are going to be spending the next 5 years with. So yes, whenever you start, you will have a few essays and lectures and things to do, but I wouldn't get straight stuck into like the academic heavy duty library all the time straight away, because once you get in the routine of that, it can be hard to break out of it, and especially if everybody else is socializing and you know each other, you don't want to be kind of left on the outside. So I'd say kind of socializing is very important. As well, talking to older year groups is quite a good thing to do. So to find out from them, about lectures and what lecturers are like, and if they have any notes that they'll share. Obviously, I'm sure it's the same in medicine. In first year, you will often have the lecturer saying, well, you have to buy this textbook that's like £200.
Yeah.
And it's like 2 pages out of the textbook that you use. So sometimes it can be worth talking to the older years to see if there's textbooks that they will either lend to you or sell you for cheap, or if they can advise you, like, don't bother with the textbook. But I'd say first year, kind of do attend lectures, do pay attention as much as possible. Once you get on a little bit, you do tend to learn which lecturers just read off the slides. But over time, you learn which lecturers you can just not go to and things like that. But I would say first year, try and really get stuck in with like lectures and socializing and things like that. Also being aware that it is tough, especially if you've moved away from home and things like that, to go to university and suddenly you're just thrown in and it's all different. It is okay to get a bit stressed. It is okay to have minor mental breakdowns and have a cry sometimes. But after a few months, you do find your feet and you do get into the routine of university life, and it does get a bit better. So yeah, I would say that if you are struggling at first, just give it a little bit more time, probably.
Yeah, for sure, and I guess that applies to every degree in that.
Yeah.
I guess all the points that you said. The one about, yes, taking your first year and just taking what university has to offer, the good, the bad, I guess sometimes the ugly, but also just, again, engulf yourself, not in just the academic side, if that be, as you said, find out which lectures are lazy, which lectures actually try, but also find your niche.
Yeah.
Do extracurriculars, attend societies like this, attend sports events, just, I guess, hard with COVID, but try and immerse yourself within the university experience, because at the end of the day, you're there once.
Yeah, and it's not cheap to go to university, and I think it is a bit of a shame if you go and you spend your whole time in the library and that's it. Because every university has like so many clubs and societies and trips places and nights out and like so much to do, and you don't want to come out of it and look back and think, God, I really spent all my time in the library and I came out with the same degree as everybody else, the people who did have a good time. So yeah, I would definitely make the most of the general university experience and kind of get out there and meet people and have fun. especially if you are doing a course like medicine or dentistry that is, long hours, you've got clinics during the week, it is quite intense. You do want to be able to allow yourself some evenings and weekends just to have fun and just forget the degree completely and have a good time.
For sure. Yeah, again, a massive thank you for taking the time of your evening to come speak to me. It's been a real pleasure. I say it to everybody that I speak to. It's always a real pleasure for people to give up their time out of their day to come speak to me and just share their story so openly.
Yeah.
So, massive thank you to that. Is there anywhere our viewers can find you online or get in contact with you? Do you have any other questions?
Yeah, so the only social media I really have is Instagram. So my page on there is Dr. Nicholl, so dr.nicholl. I have had people message me in the past who have seen me elsewhere in other videos and around the place asking for advice about various things. So yeah, I am always happy to answer questions and give advice and things like that.
For sure, no worries. Yeah, again, massive thank you, and hope you enjoy the rest of your evening.
Yeah, you too.
Thank you.